Welcome back to the channel. I just thought I'd do a video to update you all on my health situation, as I haven't done one for a little while. Anyway, but before I start, I'll just give you a quick history of my health situation in case you're a new viewer here and you don't know the history. So very quickly, I live here in Shenzhen, China, and I was diagnosed with breast cancer. And I agreed a treatment plan with the doctors, which started with chemotherapy. That first chemotherapy was unsuccessful in reducing the size of the tumour, so I went in and had surgery. That surgery was about 6 weeks ago or so now, and I'm now on a second stage of chemotherapy. Okay, so where are we now? So as I said, I've had the surgery, and by all accounts, from what the doctor's telling me, the surgery was very successful. They did find some cancer in the lymph node, so they did a lymph node dissection too. Now, I thought that was possibly going to be the end of it. I didn't sort of 100% realise that there would be chemotherapy after the surgery. Now, many of you who are watching this who have gone through breast cancer before will probably be very aware that there is chemotherapy after the surgery. And the main reason for that is because there may still be the odd few cancer cells in the body, so that's what this chemotherapy addresses. And further to this, I will also have radiotherapy now. So after surgery, I went to see the oncologist. We agreed a treatment plan, and that treatment plan was 12 cycles of chemotherapy, which is a different drug to the first chemotherapy I had. So the side effects are somewhat different. And I'm now into my, in fact yesterday, today's the 8th of January. Actually, tomorrow the 9th is my birthday, so I'll be 1 year older tomorrow. But yeah, today's the 8th, and I had my 4th cycle of this current chemotherapy yesterday. However, that was slightly delayed. The problem I'm having with this chemotherapy is it's making my white blood cell count very low, and the hospital, the doctor won't authorize the chemotherapy unless my white blood cell count is above the level of 1.5. So on Tuesday, when I was due to have the chemotherapy, so that would have been Tuesday the 4th maybe, I went along to the hospital. Now, before I have every cycle of chemotherapy, I have a blood test. So just to give you an idea, I go to the hospital. I arrive there about 9 o'clock. The first thing I do is I go for a blood test. That blood test takes between 1 and 2 hours to get the result. So I wait for the result. I get the result, then I go and see the doctor. The doctor then has a look at all my blood levels, and as I say, the main one they're looking for is this white blood cell count level. And if everything's okay, she then books me in for my chemotherapy on the afternoon. I also try to book that visit in on a day where they can change and service the dressing on my PICC. So I like to go on Tuesdays. They don't do that on a Wednesday or so they do it Tuesdays, Thursdays and Fridays. But anyway, that's beside the point. So then, if all being well, the doctor books me in for my chemotherapy. So I then go and get some lunch. I then check in to have that chemotherapy, and that takes somewhere between sort of 3 and 4 hours, because you don't just get the chemotherapy drug. They issue, first of all, I get some saline solution, and then they give me a number of other drugs. One is an anti-sickness drug, one is an anti-allergy drug, and the reason I have that anti-allergy drug is they found a number of people have a bit of an allergic reaction to this particular chemotherapy drug. so they tend to give this anti-allergy just to offset the effect of that. But luckily it seems I don't have an adverse reaction to this drug, so all good. And then I end up leaving the hospital at around I don't know, probably about 6:30, 7 o'clock in the evening. But this week was very different. So on Monday, I think it was, I went to my local clinic and I had an injection to boost my white blood cell count. But when I got to the hospital on Tuesday for my chemotherapy, my blood cell count was too low, so I couldn't have it. So prescribed some more injections, went back on Wednesday, Wednesday, and still the same problem. Thursday, the same problem again. So again, going back on Friday, finally my white blood cells were at a level where I could have the chemotherapy. So I had the chemotherapy on Friday. Now what the doctor's done, she's prescribed me a higher dose of the injections for next time. So before I go to the hospital this time, I will get 4 injections at my local clinic of the drug to help boost my white blood cells. So hopefully this Friday, coming Friday when I go to the hospital, everything will be okay. But I will let you know in a future video on that one. Now, as regards the side effects to this chemotherapy, in total I've got to have 12 weeks. And I'm now 4 weeks in, so next week will be my 5th one. So I'm already a third of the way through, which is a good feeling. The side effects are very different to the first chemotherapy I had. This time I haven't had anywhere near the same amount of problem as my first chemotherapy with regards to my appetite. My appetite's been pretty good so far. However, I do feel a numbness in my fingers and my toes, and the doctor says this is quite normal. It will actually get worse throughout the 12 weeks of the cycle. So I'm dealing with that. I also tend to feel much more tired than I felt without the chemo, and in between stopping the first chemo and having the surgery, my hair did start to grow back, but that's kind of stopped again now while I'm on this chemotherapy. So I'm gonna have to wait another sort of 7 or 8 weeks, I guess, until this chemotherapy stops and my hair starts coming back. So yeah, that's pretty much most. Oh, I'll just tell you that. So yeah, what the doctor said is if this chemotherapy I had yesterday, which was the 4th dose in this cycle, I had the full dosage now. If this white blood cell issue continues, she's going to reduce my dosage of the chemotherapy drug to 80% of what it is now, because she's concerned about my white blood cell count. So I still can't get out and about yet to make videos much on location, because having a low white blood cell count leaves me much more open to getting infection, and with that possible risk, I try to sort of stay inside as much as I can. So yeah, that's pretty much all I've got to tell you for now in this update. I will obviously keep updating you in the future. You will probably see more videos from me because I feel well enough to make videos. The reason I haven't for a little while, there's been a little gap, is that I've just been busy traveling backwards and forwards to the hospital. So I've been there like 4 days this week out of a 5-day working week. So every day it's like, because it's about an hour and a half there and an hour and a half back, and then a few hours there waiting for the blood test results and all that. So yeah, that's what it's sort of about. But it's really good to know that all you guys are supporting me. That's a really great feeling. It helps me keep very, very positive. Anyway, as always, as I say, for now, see you in the next one, and for now, take care.